talking a little bit about personal statements. What do we know about the personal statement changes? What's happening this year? What do we know? Guys, your break is going to be at 1 p.m., 1 to 2 p.m. So we're just going to go through personal statements now. You're right. Yeah, so it's three questions now. So your three questions, they don't actually make a big difference. So UCAS has been very clear. The content is exactly the same. It's just that it's now been split up into three sections. You're covering exactly the same kind of stuff. What did you learn? Linking it back to medicine. What did you take from the experience? Why does it make you want to study this career? So don't let the three questions kind of put you off. Don't let them confuse you. The three questions, the idea behind that is just it should be a little bit easier. And the whole point is to make it fairer for students so they know the kind of things they need to talk about. Because in the past, we've had sort of problems with students from certain backgrounds. Maybe they don't know how to write like one continuous prose as they're not sure what to include. And this is just hoping to make the process a bit simpler. The actual stuff you say is the same. So keep in mind, this is from the UCAS website. Many medical schools, they're not going to score your personal statement. So the only time it's really going to matter is one, if they're looking for minimum requirements, looking for the right course. And even then, not all of them will do that. But more importantly, that it could be important at your interview stage. So if you keep in mind, this is an example for Lancaster Uni. You can see that they use the personal statement at interview, but they don't consider it as part of the selection stage. So if you write something on your personal statement and you've not done it, it's not going to help you get in. They're not using it as the selection process. But after interview and at interview, you might need to talk about it. And if you imagine you've lied or you've made something up. So I saw in the chat someone talked about exaggerating. When you exaggerate, that's not going to help you get in, but it could definitely stop you getting in if they found out that you've lied. Now, this is very, very rare. Lancaster is the only uni that has said anything like this about verifying. And even then, I've not heard of them actually doing it. It's likely to be only a very small sample of applicants. But the discussion at interview is quite common. So don't let that trip you up. And so Junhao, did any of your interviews ask about the personal statement? How did you find it?
So I knew going in, there are certain universities that disclose that they do not use the personal statement at all and will not ask about it at interview. So out of Cardiff, Birmingham, Bristol, and Oxford, the only university that brought up a personal statement was Oxford, and it's in one of so Oxford at the time, I think they still do, is four interviews, so a preclinical and a clinical per college. And I only had it brought up in one of my preclinical interviews at Trinity College. Um, and it was more of a Oxford generally tend to do it as like the first question as a way to sort of ease you in. They're not necessarily assessing you on it. I think I gave a pretty poor response on my personal statement interview question. They sort of brought up one of my super-curricular projects, and one of my current tutors now basically spent 5 minutes summing up everything that I did and then expanding on it. And I was like, what else can you add to it? And I just couldn't say anything. And that actually gave me the spur on like afterwards to research more about it. But it was fine in the end. I spoke to them afterwards. They're like, yeah, we don't assess you on it, like specifically. But it is definitely worth like knowing everything like in your personal statement and knowing basically like kind of having areas you're like, okay, so if they were to ask me about this point in my personal statement, this is what I would say, this is what I would expand on. That's generally a good principle to have. You can kind of figure out like what in your personal statement leads to more questions. Like you can in a certain way phrase your personal statement that leads to open-ended questions which you have prepared for. Um, yeah.
For sure. So, in terms of what the unis do, just like we've heard, it's only a very small part of your interview, even if it comes up, except for some, like Southampton is very extreme. They annotate the whole thing. But for the majority, it's only a very small part of your interview at ones like Oxford, like Imperial. So, I wouldn't worry about it too much. Just make sure it doesn't catch you out. So, the kind of things that med schools might do, they might score it and use to shortlist. That's very rare. So, only Kiel will score it. More likely they'll just read it and check for minimum requirements. For like at Birmingham, they're not going to use it at all, but they might read it and check you've got the word medicine and there are no red flags. So that's not something you should spend too long on worrying about, but obviously do write it. Sometimes universities have certain things they're looking for beyond that, but it's quite rare. Like Bangor has asked for awareness of the training process, St. Andrews looking for some kind of caring experience. But again, that's just a yes, no kind of thing. That's not that they're using it to decide whether or not you get in, just meet that minimum requirement. And for some of them, they're not going to read it or use it at all. So all these different medical schools, Brighton and Sussex, Plymouth, Bristol, Sunderland, Sheffield, they don't see it. So you could have dentistry on your personal statement, they'll still accept you, provided the interview is good. So keep in mind that the main use is at interview, but that if you're applying to Kiel specifically, it could matter a little more. For dentistry, they can to some extent be using it to shortlist a little bit more than the average medical school. But again, the main factor still remains UCAT. And when they are looking, it's usually, again, they're looking for certain requirements. It's just that the requirements might be a little bit higher. So they might be looking for some kind of experience, some kind of recognition of the field of dentistry. So while medicine is kind of very limited in what they expect on work experience, for undergraduates, there's pretty much no requirement. For dentistry, some of the dental schools are looking for it. And in that case, they might want to check, is it on the statement? But it's not a huge factor in either case. We've got our three questions. And this is what you're going to be doing for 2026 entry. We've got, why do you want to study this course or subject? How have your qualifications and studies helped you? What else have you done to prepare? Now, the character count is exactly the same. It's the same 4,000 characters. The stuff you talk about is exactly the same. And the way you split it up between these three questions is entirely up to you. Now, my recommendation would be these are the same questions for everyone, but for a medical applicant, I think one and three are probably going to be more significant. And we'll look at why in the context of UCAS advice in a second. But I would say write more for one and three, write a little bit less for two, but a little bit in every box. So UCAS has said quite clearly the amount in each question should vary depending on the course and your experience. And naturally, if you've got more stuff to say about, say, qualifications and studies, if you've done like lots of different Olympiads, then maybe your two is a bit longer. But generally speaking, three should probably be the biggest one because for medicine, kind of insight into the profession is so big. Three is probably going to be most filled out. So if you think about each of them one at a time, we've started off with, we've got all of these same things, volunteering, work experience, insight days, super-curriculars. Same kind of weighting that you would want to have before. So biggest weighting on your experiences like work experience, volunteering, stuff that you can relate back to qualities, your communication, teamwork, leadership. Your why this course, about the same. This is proportions on your statement. Little bit of science, especially if you're applying to Oxbridge, you want to have around 10-15% some science on there. Only a small amount of extracurriculars, and make sure you're relating skills and qualities back to medicine. So we've got some of these examples here, the kind of things that you want to be including, like communication, teamwork, resilience. And I just want to say, so kind of Junhao, what was your experience with some of these? So what kind of things did you use to show communication or teamwork? Some of these big ones for you personally.
I the way I tended to do my personal statement was sort of incorporate extracurricular, supercurriculars within academics. So like I would talk about like medical summer schools and perhaps some of like the extracurriculars we did alongside that in like teams and things. For example, talking about doing like a presentation on a patient case, which is something we did in Imperial Summer School, and like how we worked in a team, the sort of challenges we overcame, and that sort of thing. Um, and then in terms of like leadership and other things, and I think that essentially again, team working stuff where you've taken on a leadership role, like within the same sort of experience and example, you can show how, like I think in that same example, I talked about how there's times where I led the team, times where you sort of have to take a back seat, listen to others, like work, like you can basically demonstrate all the different team working leadership skills through one example. I mean, to work well in a team, that's what you should have done anyways. So it's generally pretty easy to do it with one example, and it'll shorten your word count, character count.
For sure. And I guess the main thing is it doesn't matter what you've done, it's just how well you're relating it back to the question and discussing, say, teamwork. So are you kind of saying what you did to work well in a team? Did you distribute the roles out based on what everyone's strengths and weaknesses are? Did you ask the other members of the team what they wanted, what they thought was more important? Did you consider their priorities too? Did you help to plan it out? Did you accommodate? So on. So exactly how were you a good team worker? Now, how you want to start going about this is maybe making a list of what you've done, group it into what you definitely want to include, what you maybe want to include to try and prioritize, but thinking about how you want to try and represent each of these qualities in some way, leadership, communication, teamwork, resilience, that kind of thing. And we've got some good keywords that would be worth including. So things like multidisciplinary team, like we heard about for the oncology talk. So that could be one way you include it. And you talk about kind of all the different people that will be involved for a care of a patient. So like we had surgeon, oncologist, radiologist, cancer nurse, so on. We've talked about primary prevention, so all about stopping health problems before they even happen in the very early stages. We've got holistic medicine, so looking at kind of not just the biological side and the treatment and the illness, but also considering social factors, also considering psychological factors, looking at patient care in a broader sense, and trying to consider kind of a patient's individual circumstances to support them with things like that. And we've got patient autonomy, so kind of respecting the patient's right to make their own decisions. Now, I think the key thing with this and with questions is that sometimes people can find it confusing what should go in each box. So if we've got the three questions here, and we've got why do you want to study this course or subject, this is effectively the same as when you do your introduction on an old style personal statement. So if you're looking at one, like I shared mine yesterday, you want to see how the introductions work, and that is how this kind of first box would be filled. Why do you want to study this course? And you want to make it personal. Think about your own reasons for studying medicine or dentistry, but it doesn't necessarily have to be one event. So either you could talk about, say, one experience, and you could say, well, I had this conversation with an oncologist and that inspired me, or I read this book and it inspired me. I'm doing a graduate degree, and in my degree, I learned about this field. When I was volunteering, I saw this. When I was younger, I got ill. So it could be one example to start off with. Or it could be a more general discussion of why you ended up choosing a career in medicine. And so, Junhao, what was it for you? Did you pick like a specific thing or was it more general?
Mine was more general, and then I ended up sort of weaving in examples of motivation within like work experience examples later on. But yeah, for the introduction, definitely more general.
So definitely both are valid options. It just depends on you how you want to phrase it. But if you're really struggling to like fit everything in and you're struggling on characters, then if you start with something specific, then that means you've not used too many characters. It just really depends. So both are good options. And like there's one on the Oxford University website, that's this one here. And you can see it starts off very generally. It talks about kind of in just like generic terms. It's not a decision they've taken lightly. They've thought long and hard about it. And then they're going to talk about, well, what kind of things did they find? Alternatively, I've got an example here from mine, and I talked about one specific event, what I saw, what I learned. Either way, after you go for the one event, your rest of your personal statement has to be talking about lots of different factors, not just one thing. So this is just how you open it. And you want to start off with one specific experience, and then you want to talk about maybe two or three other things. So you start with your introduction, one specific experience, then you give a few other reasons. All of the sorts of things we talked about today, like in the work experience talk, relating those qualities back to you. So you're interested in a varied career. Why are you interested in a varied career? Because you enjoy science and because you enjoy people. Or you're interested in research. Why are you interested in research? Well, because you did this thing with cancer. You did a research project on checkpoint inhibitors. Or you really enjoyed reading a book about checkpoint inhibitors. You watched lots of podcasts about new cancer therapies. You read an interesting research article that showed the improvement in mortality when you use two different chemotherapy drugs. So the kind of thing like we did today could very easily fit into your why medicine section. And so the oncology talk you could use in different ways like that. What did you learn? Why did that make you want to study medicine? That's your first box. We've then got the next box, which is all about how have your qualifications and studies helped you to prepare for this course or subject. So some people are a little bit worried. They say that and they think they have to write all about their A-level subjects. So, Jim, just from your perspective, if we think about your personal statement, How much did you write about your A-level subjects out of 4,000 characters, if at all?
I've just brought it up actually just so I can remember things. I spoke a little. My school quite encouraged me to speak about it, so I spoke a little bit about A-level biology, but that was in reference to something that I saw at work experience, to do with like jugular vein, like punctures and things. And I talked a little bit about stats, and that's about it. The rest of it is mostly super curricular.
Completely agree. So, yes, definitely feel free to talk about your A levels here a little bit. But the main thing here for experience, qualifications, and studies, it doesn't have to literally be the stuff you studied at school. It's a little bit broader than that. So, your qualifications and studies include supercurriculars, projects, essay competitions, research projects, presentations, team competitions. And if you do talk about your A level subjects, just like Junhao mentioned, you don't say, in biology, I learned about the heart. What you can say is, well, I learned about this, and it motivated me to take my reading further to learn about this XYZ beyond the course. So, like we had the jugular venous puncture for the work experience and that side of things. So this is what UCAS said specifically about this question in the context of your medical personal statement, question number 2. So they gave examples. It's not just your qualifications. It could be how you got involved with school life. So do you do any clubs? Are you a class representative? Are you in the school council? Have you done any biology or chemistry projects? Have you read about infectious diseases? Have you read about oncology? Well, I hope you have after attending this 1 hour talk, so you know a bit about oncology. Have you done any online, like open courses? Did you find a neuroscience course and read about it? Did you read any books? That sort of thing. So, any kind of learning or supercurricular you've done will fit in qualifications and studies. But I would be very, very wary of this. Don't fill in this box too much. And I'm going to talk about why in a second, because a lot of the stuff that goes in two will probably be better off going in three. So you can fill in any kind of supercurriculars, projects, essay competitions in two, and that's a valid option. And so, for example, you can see in mine, I talked about the resilience of healthcare staff in recent years. Now, that was referring to COVID. At the time, it was very obvious. But I think if you were doing that today, you would want to be very specific. I did something in youth parliament. I talked about vaccine hesitancy, and I then did it in a debating competition. That would all be stuff that's very good to mention for how have your qualifications and studies helped you to prepare. Because they have said online courses, school life, that all works. It doesn't just have to be a qualification like a formal qualification, it's generally any supercurriculum. I've also got an example of something I've done here that would fit into box two. And I've talked about my time volunteering, how it encouraged me to read a book. That told me about the basis of cancer. What did that encourage me to do? Well, I attended a lecture. What did that made me think? Well, I had these potential ideas. So the whole idea of reflection, I read the book, I did this research project that made me consider this. Or I'm interested in AI in medicine, therefore I wrote an article, and then I decided to learn computer science and enter a competition. So try and link things together. And this would be the kind of stuff you could put in box two, but I would be very careful because I think it's a lot better off putting some of this stuff in box three. So we can definitely talk about supercurriculars in isolation. So we can say, I'm interested in AI, and therefore I did this. And in that case, it's fine in box two if it's just a supercurricular. But it might be better off to put it in box three and relate it to work experience or volunteering. So box three is all about the kind of stuff you've done to prepare outside of education. And that's going to include work experience, volunteering, any part-time job you have, if you care for family members, any extracurriculars. So this is the kind of stuff that you're then going to reflect on and relate back to a career in medicine. And when you're talking about these things, you can then also link them to supercurriculars. So you could talk about your volunteering in box three, and then you could then talk about how that made you want to read more. So just like I said, I could put this cancer stuff in box two. Well, it could also work really nicely in box three if I relate it to my volunteering and work experience. So I would say as a medical applicant, you probably want to be writing more in box three than box two. If you have isolated supercurriculars, put them in box two. But if you've read about stuff that relates to, say, your volunteering, or if you've got stuff that relates to your part-time job, I would put that in box three. Does that make sense? So someone is asking, where would I put my EPQ in box 2 or box 3? Well, it depends. It could go in either, but if your EPQ is just standalone, you just did that EPQ, then put it in box 2. If you did that EPQ because of your part-time job or because of your work experience, because of your volunteering, then it could also go in box 3. Does that make sense? So stuff that goes in box 2 can also go in box 3. There is a lot of overlap. You don't want to mention the same thing in both. So you only use one thing in one time. And Zara, does this mean box 2 would be a lot shorter than 3? No, it's not a problem. That's exactly what I'm recommending you do. So I'm saying keep box 2 shorter than 3 because based on what UCAS have told us, where's it gone? It can vary depending on course and experience. So that's not a problem for them. It doesn't have to be equal. Have some stuff in 2, but I would make 3 bigger. And Junhao, yeah, go for it.
I was just going to say, like, what, like, if your school allows and where possible, just to communicate with the teachers about the reference they write. So with my school, they asked me to basically draft up like points I would want them to include. It's basically just to, it's not necessarily a bad thing if they do overlap, but like to stop them overlapping on the same experiences you've had, but also then that they can double up on. So basically, they also read through my personal statement draft before they did their reference. So like they could double up on like personality traits or like qualities that they could sort of communicate and make sure to reinforce like this is the person that he is, and then also like like I said, not to overlap on certain things. And there was certain like experiences and examples where like I went to a bunch of different like summer schools. I did a bunch of work experience, but there's no way I was going to just list them out in the personal statement. That's not what you want to do. So like I basically used that as a funnel to like list out some of the experiences I had. But yeah.
The idea is very good. I would certainly, you can do it. I would just be very, very careful with what you expect the outcome would be when you do that. So when we're talking about how the personal statement and the reference get used, we're saying they're usually just being checked for minimum requirements, but sometimes they're being seen at interview. That's the only reason they matter. Or in the exception of Kiel, they score it. The reference is exactly the same, except none of the medical schools score the reference. None of the medical schools kind of use that to shortlist. They are just checking it for minimum requirements and red flags. So at somewhere like Oxford and Cambridge, where they can occasionally be holistic and they can sort of look at people who are borderline in a broader sense, maybe it makes a very slight difference if you're borderline. But for the majority of medical schools where it's MMI format, the interviewer is not going to see your reference. The person shortlisting you is not going to see your reference because it's based on UCAT and GCSE. So the thing is, the stuff you put in your reference, don't expect that they'll necessarily see it. So definitely prioritize the stuff that you want to be seen at interview, that you want to talk about. Put that in your personal statement. Anything else, yes, feel free to ask your teachers, put it in the reference, but don't expect that it's necessarily going to be seen by anyone. It's very likely that it's going to be disregarded or barely read at all. The reference tends to just be used as a red flag. So do be mindful of that. But obviously, if your personal statement is full, yes, it's better to put it in the reference than not at all. So if we look at what kind of stuff UCAS has recommended for box 3, we're thinking about stuff like volunteering in a hospital. We're thinking about stuff like any kind of work experience. It could be in any sort of caring role, like people who are ill, disabled, disadvantaged. But if you don't have anything like this, you can also relate it back to any part-time jobs or any like general volunteering you do. So have you worked in a shop? Have you worked in a fast food restaurant? Have you dealt with any adversity in your own life? Do you care for any family members? You can always relate that back to medicine too. So any kind of activities and that sort of thing that you've been involved with. So like we said, it's a good idea to link your supercurriculars to your work experience in volunteering. And the kind of framework you might want to use for that, something like we've got STAY here. So when we're talking about qualities, stuff like teamwork, leadership, so on, it's a good idea to start with a specific situation. So what did you see? What did you observe? Pick a theme. So, did you see good communication? Did you see empathy? Did you see teamwork? Did you see that they were shared decision making? And so, what do you think I mean by shared decision making? What do you think it's all about? So, who are we sharing with? So not necessarily MDT, even though we do share decisions with the MDT. When we use the word shared decision making, that usually is all about working in partnership with patients. So the key thing is working in partnership with patients, their family, their concerns, respecting that. That's what we mean by shared decision. So talk about that's the situation, what you saw. This is the theme you identified. Well, there was good communication. How specifically did you observe it? So what did you see? Was the doctor using very simple terms? Did they find the right setting? Did they kind of did they use kind of were they good listeners? Did they repeat back the things that the patient said in a couple of words? So how were they a good communicator? What did you learn from it? So you learned the importance of good communication because you saw what an impact it had on the patient, what a big difference it made. And maybe that's something you tried to replicate. Did you go on to try and practice the same skills when you were volunteering? And also, if you saw, say, something like a consultation, did you do any kind of reading, any kind of research to do with the condition you saw? So that's all about when you're going to reflect. So you've got situation, theme, analyze, and bring it back to yourself. Stay. This kind of idea. So, Jinha, do you do anything like that in your personal statement, kind of reflecting on a quality like communication, teamwork?
Yeah, I'm just sort of reading through that I can find an example.
What kind of qualities did we pick up on?
I think a lot of mine's about like observing and reflecting. But that's a general thing that you kind of see throughout personal statements. Some of mine is also about like exploration of things that I see. So a lot of mine builds, so when I introduce my super-curricular stuff, I'm building upon like, okay, so I've seen this in work experience and this made me really inquisitive. Like on the night of, I looked into this, then I did this, sort of like showing that I'm interested in what I've seen, and I have an interest in this sort of area. Um, the rest of it, there's stuff about like soft skills, like teamwork and leadership, and like work-life balance and how I maintain that, and general things about how to adapt to communication. So I've got stuff here and talking about like communicating with blind patients and those that I've supported as a patient befriender, and how to overcome hearing difficulties and vocabulary limitations, and how I've learned some of those sort of skills through actually communicating with patients, there's also students who don't speak English and those sort of things, and peer tutoring, and like tailoring communication.
Really good. So all about this idea of exactly how are you a good communicator? Well, you tailor it to the group of people you're speaking with. If you're speaking with students who are maybe struggling with maths, we'll try and describe in simple terms. And I know you were working with asylum seekers, so kind of maybe you need to communicate more sensitively because they've been through traumatic experiences, anything like that. Someone is asking about caring for chronically ill family members. You can definitely still write it. You can definitely still reflect on it and talk about it. The only thing is, if you can get the official carer diagnosis, like not diagnosis, but carer status, it can also mean some unis will take you as contextual. So do try and get that approved officially if possible. But otherwise, for the purposes of personal statement, yeah, you don't need to be anything official. It's just about what you reflected and what you learned. In terms of who can write the reference, that does depend on what your position is. If you are in school right now, then yes, it has to be a teacher. If you have left school, then ideally your last most recent place of education. If you're at uni, then it would be kind of someone responsible for your education there. So like a personal tutor, or if you have like someone head of department who's open to doing that. If you've been in employment for the last 10 years, then obviously it's a bit different. And they do have exemptions for like homeschooled people, so on. So it depends. Would a pharmacist be accepted? That really depends on kind of who you are and what your role is. So a pharmacist probably wouldn't write your reference unless kind of you're someone who is not affiliated with any school or university and kind of you just work at a pharmacy. And in that case, yes. But usually there's just one reference and it's written by either your university or your school. Right. So we've got an example here how I did that kind of stay thing. Situation, theme, analyze, reflect. So what happened? I had work experience. What did I see? Well, a mother was quite frightened, and the neonatologist was sensitive. He was a good communicator. How did he do that? He listened attentively, and that showed that he was empathetic. So I'm not just saying he was empathetic, I'm saying why, because he was a good listener. How have I reflected on it? Well, I've tried to do the same as a volunteer. And I've also reflected on some of the science stuff, and I've mentioned a supercurricular project. So you can see that supercurricular projects like this will fit in nicely into box number 3. For volunteering, we want to do something very similar. So talking about what did you do, show some kind of sustained commitment, what did you learn, did you develop any qualities and skills, how is it going to make you a better doctor? So this is like the one on the model statement on the Oxford website. What did they do? Well, they served meals to residents, they fed people who were infirm, and it's made you realize that there's an unpleasant side of medicine, but still you genuinely enjoy doing it. And you still feel that it was very rewarding, you've made a big difference. So this is all that idea about the holistic side of medicine, caring for the emotional needs as well. Does that make sense in terms of how you reflect? Yeah. So this is how you go through volunteer. Now, just before we finish off, some last minute questions. So, not to include that you have family members in medicine, generally could be counterproductive. May imply nepotism, may also imply that you're being forced into the profession. So, best to avoid family members in medicine. Just speak about kind of more generally what makes you want to study that profession. Avoid anything cliched that is overused, like from an early age. Avoid unnecessary adjectives and adverbs because they waste characters. So don't say genuine interest or unfaltering motivation because that doesn't add any value to you as a candidate. And in terms of A or B, what do you think for the first one? If we were running out of characters, which one should we take out? Yeah, so A should be taken out. It's not relevant to medicine. What about for this one? A or B? Again, yeah, take out A because B is kind of more something that you have personally gone out, sought out, tried to do. And again, A or B for the last one. Yeah, brilliant. Now, other things to avoid, well, you want to avoid being too descriptive based on, like, this is the Newcastle Uni website. So don't kind of just say what you saw, focus on what you learned. Don't just describe what you saw. Don't be too vague. So actually mention what you learned. Don't just say, I learned good communication. So being too descriptive and too vague, that sounds contradictory. What we mean is don't describe too much kind of what was happening, but do describe a lot what you learned and what you developed. So be very specific, but don't just describe like, oh, I was in the hospital and the doctor, he walked in and he gave this specific type of injection. Like, don't tell a story, but do prioritize what you learned. Structure is less of an issue this year, actually, because they already give you the 3 questions. And don't do any kind of name dropping. So don't mention the names of any organizations. Like you would never say that I attended a MyUCAT work experience because that's a waste of characters. It's not telling anything about you as a person. You would just say that you attended the work experience and this is what you learned. So I think let's leave things there. I will take some questions now, but if anyone wants to go on your break, feel free, and we'll see you guys again at 2. So now is the chance to go write those LinkedIn reflective pieces. And like I said, the best 5 that I see that have gone in the most depth, the most reflection, linked it back to yourself, linked it back to research that you've done. The best 5 will get free places on our summer program, covering all of UCAT interviews, personal statements. So best of luck with that. I'll stick around and answer some of the questions in the chat, but feel free to go on your break now. And Junhao, thank you so much for sticking around, helping these guys. Any last minute tips for them?
Um, in terms of personal statement, like I just mentioned, like it's not going to be the end, like be all end all decider. At the end of the day, it's going to be UCAT, GCSEs, A levels, and whatever happens with your academics. But it is something that will help you sort of frame what you might want to say at interview as well. Like for me, I found like going through loads of my experiences. I would say one key thing now remember is like whatever experiences that you do go through, work experience, summer schools, these sort of programs, do write a reflective piece because in 6 months' time or even 3 months' time, you will not remember like the key like important takeaways, or at least not to the detail that you need for a personal statement. Um, and then when it gets to sort of drafting time, you can then have these like list or folder, which is what I had, of like experiences. You can go through, pick out what you think is most relevant and important and shows the best about yourself. And then on those, you can sort of expand and sort of write it more in prose. And then you'll have like a list of different examples and things. You might not use all of them, but you'll have also those examples like written in an eloquent way that you could also speak about in a similar way at interview. So that I think that's a key thing.